Assalamu alaikum, everyone. My name is Dr. Zahid Rafiq. I'm a family physician here in Calgary and one of the trustees for MDI International. I'm here to introduce our active living session. Um, we're doing every 2 weeks active living session for active living and exercises, different exercises. We have with us today, Ramesh Bimagani. He's a physiotherapy. He's a director owner of Genesis Physiotherapy and similar other physiotherapy places in Calgary. We were blessed to have him last month also for exercise for back. Today he's here with a very interesting topic. He's going to talk about knees. So the topic for today is, oh, my knee hurts. Being family physician, I'm familiar with so many conditions. We see so many things about regarding knee, starting from smaller age to older age with different problems. So the kids come with knee problems, can be growing pains. Teenagers with sports injuries. In school, some injury happens. Hockey is very popular in Canada, so hockey injuries, soccer injuries, older age arthritis. Then we have other inflammatory causes. So I don't want to take too much time away from Ramesh. Ramesh is going to go through the knee issues, and let's see. Oh, my knee hurts. Ramesh, it's up to you. Over to you.
Thank you, Dr. Rafiq. Hello, everybody. This is Ramesh again. So hope you all enjoyed my last month's class. That was Know Your Spine. And here I'm back again today with how my knee hurts. So it's basically, I'll be discussing more about the common knee conditions, and then followed by I'll throw in some exercises to kind of just, so for a healthy knee, and then if at all you have any injury or any of those things. So you have some kind of an information where you can actually get started even before kind of just, running to see your physician or the doctors. And then if it's not helping, definitely you can just approach your doctor and then the physiotherapist. Okay, so let's get started. I know we're kind of past 7 p.m. here. So I do have a knee here so that I'm going to make things easier if I kind of just have the knee in front of us, and then, so that way we can kind of just really self-assess, and then, place your hands over the knee and to see like which structure is where, and then what's the common injuries around that area, or the pathology, what we call it. And then followed by, I'll kind of just, go over some exercises at a later date. So depending on the time, I'm also going to actually kind of show some exercises around the hip. Usually it's very important when you're kind of just talking about a knee rehab to actually kind of just address the hip exercises as well. So they kind of just go hand in hand, and followed by some ankle exercises. But today's topic, I'll be focusing more on the knee, and then some exercises for the knee and the hip. And followed by, like, I'll kind of just put the sports injury part in a question and answer section. So at the end, like if you have anything really, in specific sport related injuries, conditions that you want to kind of just discuss about, we can definitely kind of just do it at the end, depending on the time, and then just go from there. Okay, so let me get started off. If everybody can kind of just place your hands in front of your knee, what we call it as the anterior compartment or front part of your knee. So we do have the first thing that you touch is the kneecap over here, and then followed by we have the thigh bone, what we call it as a femur. Then followed by you have the tibia, the leg bone. So the two leg bones, one is the tibia, most prominent one and the strongest one, and then followed by the fibula over here. Okay, so some people, they say that the fibula is not really important, but when it comes to kind of, and it's really hurting, and then the pathology and those kind of things, fibula does make a lot of sense. And then sometimes I see a lot of patients, with a lot of knee pain. The issues are coming out from this tiny bone, the fibula up here. So now talking about, and we are very familiar with all the muscles up in the front. So we have the quadriceps that's kind of just connecting to the patella or the kneecap, and then followed by this kneecap attaching to the leg bone through a tendon. So that's what we call it as a patellar tendon. So the quadriceps core muscles really bulky muscles up in the front, they all kind of just combine and then attach to this tiny kneecap in the front, and then a tiny attachment to your leg bone. So the reason why I'm kind of just stressing so much here is like a lot of times there's so many issues of with the kneecap itself, okay, because of variations of the forces of this quadriceps muscle that is actually kind of just tracking the kneecap either medially or most common is the lateral one because of the weakness of one of the quadriceps muscle on the inner side of your thigh, what we call it as a vastus medialis obliquus muscle. Okay, and then the other common conditions that we kind of just come across is the kneecap, the cartilage wearing out. What we call it as a chondromalacia, or just a kneecap irritation, what we call it, where you have some crepitus and then the pain that always you point out to the front of your knee. So that's the kneecap problems, issues, or patellar problems, what we call it. Okay, and then followed by sometimes we have issues with the anatomy of the kneecap itself, where it is not sitting properly in the groove or in its pad, and then it's continuously it's been tracking in or out, and then just irritating the kneecap. Okay, so for people that you might have seen who has like a recurrent dislocation of the kneecap, that is because of sometimes these contours or what you call, okay, so they're not developed properly, and then that could be the reason why you have these ongoing dislocations. Or sometimes where there's a muscle imbalance, like the muscles on the inner side are really weak and the structures on the outside, they're really dominating and then trying to pull the kneecap out, followed by you have these dislocations happening quite often. Okay, so I'll come back to the exercise part later on to kind of just give you some exercises like how you can actually maintain to kind of just help the kneecap dislocations. Then now coming to the other common problem that you see up here is uh, bursitis, infrapatellar, the bursitis. So bursa is a thin film of shock absorber with a fluid, and that's always like wherever bone to bone or ligament to bone or tendon to bone. So you have these shock absorbers to kind of just avoid that ongoing irritations of there. But situation when there's too much stress on the structures, so they start kind of inflaming, and then a lot of swelling and acute pain and those things that we need to kind of just address too. And then the other common thing that you see is the tendon getting irritated, patellar tendonitis, that's what we call it. Okay, those things. And as you kind of just come a little lower, so it is very common in, till I would say 17, 8 years old, that you would see some kind of a stress injuries or stress fractures uh, in your leg bone. So this is the common site, and this is where actually the bone growth is happening. And that's why this area is a little softer. So there's kind of more prone for injuries around this area as well. Okay. And the other thing that we need to discuss about is the arthritis of the kneecap. Okay, so when we talk about arthritis, we always talk about the anterior compartment that is between your kneecap and the thigh bone. Okay, and they followed by the arthritis between your thigh bone and the leg bone. But of course, your fibula, the leg bone is, the fibula bone is not part of the knee joint as such, and it's not contributing to the arthritis that much up in there. So we have again the medial compartment on the inner side and the lateral compartment on the outer side. Okay, so that's why when they talk about arthritis, they talk about whether it is in one compartment or two compartment or tri-compartmental, that is all the three compartments. Okay, so that is something about the anterior structures. I know there are so many pathological conditions that we need to, but most common things that I'm just talking about. If there is something that I'm missing that you're familiar, at the end, please do kind of just share with me, and then I can just go over with that. Okay. Now, coming to the medial compartment or inner side of your thigh, you kind of just place your hand on the inner side of your thigh. Then the most common issues that we kind of just come across, either it could be ligament problems. So ligaments, once again, are tight structures that are connecting from bone to bone to keep the bones in stable. So if your joint is stable, that is mainly because of the ligaments, and then followed by, of course, the muscles and the tendons. Muscles and tendon is bringing the movement, whereas the ligaments, there is no movement, they're only stabilizers. They're stabilizing bone to bone to keep the joint in place. Now, any kind of a stress on these ligaments with the sports injuries or from the fall or any kind of a trauma. So depending on the force and the direction of the force, so these ligaments, they end up tearing. There could be the three grades of the ligament tears. We call it as a grade 1, there's a grade 2 tear, and there's a grade 3. Okay, so grade 1 is a very partial tear, very minimal, and then grade 2, sometimes it is up to 50% or more. Then grade 3 is completely torn. Okay, how do we actually kind of just diagnose this ligament injuries? Basically, by doing what we call it as the physiotherapy clinics, we do something called as a stress test. So stress test is actually clinically proven good results. You don't have to really kind of just look into your ultrasounds and MRIs and those things, but ultrasound can actually kind of just pick up the ligament injury of the medial compartment, MCL, what we call it. Okay, so there's some things that ultrasound can pick up and then tell you, but there's certain things we need to actually kind of just go into MRIs, because everything around the knee is not, ultrasound is not a diagnostic tool, because the deeper the structures, you're not able to actually kind of just, look more on the ultrasound. So you have to look into, ultrasounds. But in my 15 years of practice, the clinical testing is the best. Okay, just moving on, as I said, like grade 3 is completely tear, where we kind of do a stress test and to see if it's completely torn or it's partially torn, those things. So that's about your MCL. Now, on the medial compartment, once again, we need to talk about the meniscus. Uh, it could be a traumatic injury to the meniscus, that's a tear in the meniscus, or a degenerative tear with age and repetitive stress, tremendous stress and trauma to that area that could also kind of just tear the meniscus. So either it can tear to the edges or it can kind of just tear in the center part as well. So once again, talking about the meniscus, so it's a soft tissue there, just like a cartilage part, it's a soft tissue. There's some portion, if there's an injury, it heals. There's some portion, if there's injury, then it's really, it's not healing. That's the time where they go in for like an surgical repairs or meniscectomy, to taking part of this meniscus that's not going to heal, or some of this meniscus that's kind of just popping out. They want to kind of just go trim or shave it to kind of so that it is not bothering you there. Okay, so that's about the meniscus. So usually with the meniscus problems, uh, there is a stiffness, there is swelling, there's always something inside the knee that you kind of just point out that is bothering me. I don't know what it is, like yes, inner side. A lot of times the meniscus problems, yes, you feel the pain on the medial side, and also like, on the, we call it as the posterior side, posterolateral angle. That's where you kind of just feel the pain, like people pointing to the inner medial compartment and then little going back, that's where you feel, and you're telling me that yes, it's a little deeper, or sometimes it could be to the edges, very, very rare, but you always kind of just point out there. Okay, now the other classic things about the meniscal injury is like, yes, there's a locking in the joint. Okay, so you feel like something is catching and there is a locking in the joint. So that's the meniscus part. Or you're not able to full weight bear, or you're not able to sometimes completely extend the knee, or you'll say like, okay, my knee is giving out, or knee buckling, those kind of things that we commonly see up in here. Okay, so that's about the meniscus. Once again, we call it something called as a McMorris test that we do to actually, so rule out what's the injury like, So when we do the test, we are looking for a pain, and we are also looking for that audible click kind of thing to see what is the extent of this injury damage to it. Okay, so now that's about the medial compartment. But another thing, important thing on the medial compartment, we always kind of just misdiagnose is like, so everything is not, the medial compartment is not the ligament pain up in here. So the chances that you will actually kind of just, have a pain just below your kneecap onto the medial side or the inner side. So people do point to the top portion of your tibia or the leg bone right in here. So that is what we call it as, once again, it's a bursitis happening over there. We call it, it's a name, it's called a pes anserin bursitis, because of these muscles that are tight or kind of just some of them are attaching right in here. And then if they're too tight or just because of the repetitive stress, what happens is this bursa is inflaming too. So the reason why I'm talking about is it just to talk more about the differential diagnosis, because every pain we need to know where is the cause for that. So that's easy for us to kind of actually address to that particular problem, you know, treatment wise, exercise wise, and the recommendations, do's and don'ts. Okay. Yeah, so that's something about what we call the middle compartment thing. And of course, patellofemoral pain that sometimes you might see here in the patellar margin, that you'll be saying, hey, my knee hurts right in here on the inner side or medial border of the patella. So once again, that is something that we need to talk about, the kneecap pain, what we call it as the patellofemoral syndrome. This patellofemoral syndrome, yes, you can have crepitus sometimes, yes, when you bend all the way, it is hurting. Going down the stairs or going down the ramp, walking down the slopes, that is the time actually kind of just your kneecap starts hurting more. Because for a reason, when you're going down the slope, your kneecap is trying to kind of just hug and, hug more to the thigh bone and then just irritate. Okay, the chances. Okay, that's how we do the differential diagnosis. When you say, hey, my knee hurts when I'm kind of just going down the stairs or going down the slopes, then the first thing comes to our mind is like, okay, it could be a patellofemoral pain, or patellofemoral syndrome, what we call it. Okay, so let's go back to the back of the knee. And of course, we have massive hamstring muscles up in here that kind of just comes down, connecting, some of them connecting onto the inner side, some of them connecting to the outer side, So it's not, a lot of times people like, oh, my hamstrings comes and attaches over here in the straight. No, so they actually kind of just come down and they attach to the inner and the lateral side. Okay. Now, at the back of the knee, sometimes it could be an full hamstrings or a tendon of the hamstrings that kind of just hurting, or there's an injury that we kind of just, do a clinical testing and to see whether it's the inner side or the lateral side. And the other things that you might come across, the pain at the back of the knee, sometimes it could be very common. People post-trauma, or it could be arthritic knee or a repetitive stress. And with the age, that you see a cyst at the back of the knee, what we call it as a Baker cyst, or it's a popliteal cyst. And this is actually not really a troublesome. It doesn't really hurt that much, but there is like a discomfort. The chances sometimes, yes, this cyst can actually kind of just get larger and larger. Sometimes, yes, they could kind of just open up and throw the fluid and then pain. The chances, they can come back. They do some techniques sometimes to kind of do a fine needle aspiration techniques to kind of just, take the fluid out, but the chances it could kind of just come back again. But functionally, from my knowledge, like the Baker's cysts, actually, they don't really limit your function too much, from my, years of experience. Now, the other thing, sometimes people do say that, hey, I do have pain in the back of the knee, but it's really deep, that hurts. And that's the time we actually looking to see whether the pain is still coming from the meniscus or it's coming from the, what we call the cruciate ligaments. I'll talk about the cruciate ligaments later on. Or it's the muscle, what we call it as the popliteus muscle. Sometimes, yes, deeper structures that what we call it as the locking and unlocking muscle. That's a popliteus muscle. So that could be troublesome too. So we need to identify if this is deep in. So that is once again doing a clinical test and doing a differential diagnosis, and then coming to a conclusion. Yes, it could be a muscle, but not your meniscus, and those kind of things. Of course, when patients come to us, there's a lot of history taking to kind of learning about the mechanism of injury. So that will tell us a lot about so which structure could be at fault and what is happening and those kind of things. So I believe that's something, the back of the knee. As I said, if I'm missing something, please put in your in a Q&A section later on. We can discuss about it. Okay. Now, coming to the outer side of your knee or the lateral side. So once again, we have the ligament up in here, what we call it as an LCL, lateral collateral ligament. So these two collateral ligaments, like a medial and the lateral, they're actually kind of just stabilizing the knee from side to side movement. Okay, so always any structure, these are elastic structures still, but they're taut elastic structures. Okay, so there is always some movement in your knee, okay, because you don't want your joints to be completely seized up locked, okay? Because functionally it becomes difficult. So that's why there is always some movement happening. If one of you kind of just wiggle, somebody is kind of moving, oh, my knee is kind of just, wiggling a little. Yes, that is very normal, okay? The side to side wiggle and front to back wiggle, there is a little portion that happens that is very, very normal. And actually that is when we're doing the clinical testing, that is a clear tool for us to kind of tell, like, whether that is an normal and excessive laxity, what we call it, then that's an abnormal. There's a tear that we kind of just identify there. So that's your LCL. And people, LCL is not that common, okay? So whereas MCL is like a commonly injured or torn ligament compared to LCL, but depending on the force of a trauma, yes, you could, tear LCL as well, okay? Now, the most important structure that we need to talk about on the outer side is your IT band, okay? So the thick IT band at the side of your thigh, okay? So that's the band. So it's actually kind of just starting from the hip, okay? So, and then going all the way down to the leg area and then just connecting over here. So a lot of people have constant problems at the side of the thigh. They have problems high up in the hip. They have problems at just closer to the knee area, so just because of a tight IT band, okay? So it can create a lot of problems up in there. And then keep in mind, like IT band problems, it takes a longer time because it's really a tight, thick band. So it takes a lot of time to actually kind of just stretch it out and ease the stress around that area. So always what happens is, when the reason why in the beginning I was stressing about the quadriceps muscle forces, because if the muscles on the inner side of your thigh are weakening because of any pathology or a problem, these guys, the IT band, they dominate and they start actually kind of just pulling your kneecap out and then start irritating a lot. Okay, that's why when the patient comes in, we always focus on strengthening your VMO or the muscles on the inner side of your thigh, which are good stabilizers, and try to kind of just stretch or loosen up the structures at the side of your thigh. Okay, now the common things that we actually kind of, once again, yes, LCL, it's again grade 1, grade 2, and grade 3. So we do what we call it as a stress test, trying to push the leg onto the other side by stabilizing the thigh to see, like, to what extent there is a tear in there, okay? Now, the other things, when you're talking about the IT band, so right above, when you kind of just right above your knee joint, on the outer side, if you place your hand over there, sometimes people, they kind of just keep pointing to the side over there, okay? And this is a lot of times misdiagnosed as LCL sprain. People, they say, yes, I have my LCL, I injured my LCL, okay? But not necessarily it's a LCL, because when we palpate and when we do the stress test, it's all good. But when you kind of just climb high up a bit up in there, and then when we palpate, and then it's really tender over there. So we do a special testing for that, what we call it a clinical test. It's called a noble compression test, to see if the bursa over there, or it's your IT band that is kind of just irritating over there. And then of course, we kind of just do the treatment accordingly to kind of just keep stretching your IT band, to kind of just check the forces, what we call as a biomechanical dysfunction, to see variations, and the forces. We try to kind of just modify, help with exercises, help with stretches, and those kind of things. So that's your outer side, okay? And then the other thing, like, yeah, coming to this joint right in here, that's called tibiofibular joint. Sometimes there are ligaments up there as well, but it doesn't move that much. So this particular joint, it is more for the stability purpose. There is no movement happening in here, but sometimes this can be hypermobile, like moving too much because of a ligament laxity and issues that is creating a problem in the lateral compartment of the knee. Sometimes you have pain that's kind of just going down into the outer side of the leg. That is because of the problem up in here. Or this joint is jammed, so because there's not much movement happening, then definitely that is something we need to go there and then just, mobilize the joint to loosen up and ease the stress, the pain that's going down to the side of your leg. So that's about the fibula part up in here. Okay. Yeah, this, going back to your, oh, sorry, I missed this. The cruciate ligaments, what we call it, the ACL and the PCLs, most common ligaments injured during trauma or sports injuries, okay, like a ski injuries, like a soccer, or those kind of things, right? You see this ligaments. So to kind of just brief you, they kind of just cross like this, crisscross, like, from one bone to the upper bone, bottom bone to the upper bone. They cross it like this, okay? So that's your ACL and LCL. And they kind of just stabilize the bone from forward and backward movement right in here, okay? So there's a slight give always, and then followed by, of course, they become top. Okay? So that's your cruciate ligaments, ACL and then MCL. So ACL and MCL, once again, I know diagnostic tools, but there's clinically put them in certain, put the knee in certain position, and then do a stress test once again. Okay, so we can easily identify, you know, the laxity, the ligamental laxity, what we call it. So the grading of the injury. So when we talk about grading, if there is some give and then it stops, that's a partial. Okay, so when we kind of just do a stress test and then it's completely, there is no resistance there, nothing is kind of holding. Okay, so that's a full tear. That's how we identify, in a clinical setup up there. Like, okay, and of course, this could be a combination of injuries sometimes that you have, unhappy triad, what we call it. Like, yes, you have your MCLs and you have your meniscus tears and you have your ACL tear. So it's a common, depending on the severity of the injury, the force, the trauma, and those kind of things. Okay, and of course, I'm not going to stress too much about the fractures because everybody knows what a fracture is and what it is. It can happen to anyone, anywhere, depending on the trauma, injury, fall, and those kind of things. Okay, yeah. So I believe then coming to the arthritis part, so everybody knows what is happening. So the stages of arthritis, you see, like initially there's a cartilage part. The cartilage is just once again a soft tissue there. So wherever bone to bone is coming closer, so there's a cartilage part to kind of just ease friction off from bone to bone, the harder surfaces. So the cartilage start wearing out, and then the bone starts getting exposed. That is the time you have really pain, a lot of pain happening the minute the bone starts exposing. Okay, and followed by, yes, you have things like your knee starts getting stiff and a lot of pain happening depending on the inner side or the medial compartment, which is very common. The inner side of the knee is more prone for arthritis versus, compared to the outer side of your knee. Okay, yeah. So that's something about the arthritis. So when we talk about arthritis, you need to know every, arthritis is not just osteoarthritis, so there could be a lot of those things. Could be a joint inflammatory arthritis, so there could be a rheumatoid arthritis, some other pathology, infectious, or sometimes the gouty things happening up in there. So they're like, tons of those things to kind of just, describe things, but a common osteoarthritis, yes. So, and osteoarthritis is very important to understand that it is unilateral. That means it happens in one. It can happen in both joints, but rheumatoid arthritis and osteoarthritis. Osteoarthritis is always kind of just happening in the joint, depending on that stress to that particular joint. Whereas rheumatoid arthritis, always it's kind of just symmetrical, happening on both sides, and starts up in your kind of just a tiny finger joints, and then in your foot, foot joints, and then it kind of spreads to the other joints and those kind of things. Okay? So that's something about your arthritis. Then, of course, we have other conditions that we have to think about. Whenever there's a knee problem, then your muscle starts kind of just weakening up. So you have to always kind of just focus more on strengthening to kind of just keep the joint stable and then keeps the joint mobile, and so that you're kind of just able to function, so get back and function quicker and sooner. Okay. And last thing, my favorite, always kind of just, I do stress, even on my last session, I was talking a lot about like not to forget about the pinch nerve problems. Okay. Or it could be a nerve somewhere, a nerve pathology that could also contribute to the problems or pain around the knee. So always doing those differential diagnoses to see if the problem is like localized or it is a referred pain coming from elsewhere, that we need to kind of just differentiate and just work on that area too. So that is something common structures that are at fault or injuries that we kind of just come across. Okay. Now, ankle, of course, I don't want to really talk too much because that's a complex area to kind of just discuss about. But I just want to kind of, a lot of times with the ankle, improper support, ligaments weakening up, and your arches kind of just collapsing. The arches are not supporting well, they kind of flatten up, or sometimes excessive arches, so they could contribute to some stress around the knee, and then people do have problems around the knee. So we need to always we kind of think the minute when the patient walks into us, like, okay, you have a pain over here, but where is that pain coming from? Is it, primary problem is here, or is it kind of just coming from elsewhere, contributing to the problem? So we are kind of just correcting the problem in your ankle foot, or we're kind of just correcting the problem up in the hip, to kind of just ease the problem, or address the problem around your knee. Okay, so the other things that you might have commonly come across is like, sometimes we have a bowing of the, legs, and or sometimes the knot knee that are kind of just, too close or away. Those are the other congenital problems or that comes by birth that we're not really discussing too much up in here. Okay, so I guess, yeah, that's some interesting information about your knee to learn, to have a better understanding, idea, and those kind of things. Okay, yeah. So I just want to pass on some important information here, because if I forget at the end, or if I'm running out of time. So any sports injuries, okay, if it is, if you think it's not a fracture and a quick x-ray is done stating that, oh, there is no fracture, but if you still feel there is massive damage, or you might have torn your meniscus or ligaments or some of those things, the first thing to always kind of think about is there's an acute knee injury clinic in Calgary that's out of University of Calgary, okay, in the kinesiology department. So you can always kind of Google that information, like, so acute knee injury clinic in Calgary. So it will kind of just directly take you to that website. And there is a self-questionnaire. You don't have to actually have a referral. So you could actually, put on all that information in there, and then you will be getting a call within no time, and you'll get an appointment, and then you'll be seeing sports medicine physicians, and a team of sports medicine physicians, physiotherapists, and kinesiologists over there, kind of just doing an assessment on your acute knee to kind of rule out what structure is at fault. Okay, and then if at all there is an investigations that is needed, things are a little quicker. And if, because it's a sports related problems, so even putting it, because they have the connections to the specialists over there, they things are really quicker, and the things are taken care of very well. Okay, so if they think it's a non-surgical, they're referred back to the physiotherapist for a rehab and things. Okay, so just make a note of that, because it's very important. A lot of times people, they're running around, they don't know what to do, and yes, they had a sport, but this is specifically for sports related injuries only, not work related injuries, not MVA related injuries. Okay, so for sports medicine related, sports related injuries only, it's called acute knee injury clinic in Calgary. Okay, sorry, I don't want to jump, but at the same time, this is important for the audience, so I don't want to miss that out as well. Okay, so let's get started off. I think I took a half an hour on this, but I think this is something really important to have an understanding of the knee and the problems, because every problem that you think is not, one common problem out there, they're all different. Now, where do we get started off? It's some simple exercises. So when I talk simple exercises, I'll get started off with exercises to do on the bed. So people with really acute injuries, not able to do much, and arthritic knee, less mobility, and arthritic knee, very important is, like, with arthritis, you want to do the exercises, but less impact on the joint. I see a lot of people with arthritis, they're actually kind of just, climbing up and down the stairs. They're kind of just going there and then doing a lot of squats. Squats to certain extent is okay, but not like, vigorous excessive squats that kind of is again stressing the joint. Okay, so with arthritis and things, we always need to kind of just talk about low impact exercises. Okay, that is what we call it as, and gentle active exercises, free range, bed exercises, or those kind of things. Okay. Hopefully this time everybody can hear me still, and I'm going to kind of just do some bed exercises over here. I do have something called as a knee slider. Very simple to use it. So this is very well, if you don't need to have this knee slider at home, you could always modify it. You kind of just do it on a harder surface, like on your bed. You can just put some kind of a sheet or something, or just tie plastic around the ankle to kind of just, your leg is really sliding. Just this way. Very simple, but very effective to kind of just help your range of motion. It is effective to decrease the swelling and get that pumping, active pumping going on, and then still kind of just keep your muscle active. A lot of times people are not able to kind of stretch the knee properly, so this actually assists the leg to kind of just move forward at the same time to be same too, which is really happening over there when you're not able to actively perform. Okay, so for people who don't have this at home, it's something we use in a clinical setup. We could always kind of just make things easier. Tie, or you can use your a belt, or it could be a sheet, anything, and gently kind of just go up as far as you can go. So when you're doing the exercises, discomfort is okay, acceptable, but pain, don't push into pain. That's a common terminology we use. Do not push into pain, but some discomfort is okay. Flexion and then extension. Okay, we could do this. Okay. So that's what we call it as a simple knee sliding exercises that you can just get started off. Okay, and then the other thing is a lot of times you can do fix things at home yourself. Is a lot of times this kneecap is not moving just because of all the pain. Then you have the swelling, stiffness, and those things happening. Gently kind of just let go and then move your kneecap like this from side to side. Okay, see how nicely, I don't know how much you can see, but do that from side to side and see if you can push the kneecap up and then down. Okay, so this is a simple but really a good exercise just to kind of just lubricate joint around and also kind of just some muscle activation going on to loosen up things, help the swelling, those kind of. And of course, a lot of times any problem for the ligaments, we always kind of just recommend them. So the ligaments are always this direction. So you go a little perpendicular to the ligament and you do some gentle friction massages. So they actually help a lot to kind of just, break down the scar and also kind of just create that micro trauma. So when we talk about micro trauma, so there's kind of fresh blood that's kind of just going in there. And then that's kind of just helping, accelerating the normal healing process. So you could do some gentle friction massages, what we call it around there. Okay? Yeah. So that's then followed by simple exercises always, like, so gently extending your knee, feel the stress in your quadriceps muscle. And I like to kind of just hold that in the position for like, at least 5 to 10 seconds up in there and then just let go, okay? So these are all what we call it as a non-weight bearing exercises, so that is for your quadriceps up in here. And then for your hamstrings, as simple as it is, you can go on your stomach and then gently do this hamstring curls and then just let go. Hamstring curls and just let go. Now, simple exercise but very effective. So you could advance with holding a ball between legs. And that's one of my favorite exercises. Like so less stress on the joints but very effective on the muscles. Okay, hang on one sec, please. Whether you can use a soccer ball between legs. Excuse me. Okay. So think this is a ball, or even you can hold a pillow between legs. Hold it tight. So when you're squeezing, basically, you are activating these muscles right in here. Because activating these muscles is very important for what we call as the terminal knee extension problems. And a lot of knee issues, we always kind of focus on strengthening up the muscles on the inner side of your thigh, what we call as vastus medius obliquus. Okay. Yeah. So hold a pillow or a ball, soccer ball up there. between your legs, lift up, feel a good activation in your muscles, and then let go. So these exercises are good for like acute knee, you had an injury, you're not really going to harm anything by doing these exercises, like especially arthritic knee. So these exercises are really good. That's that one. And of course, you can do the same for your hamstrings too, going on your stomach, holding a ball, and then you can just do that. Okay. So as I'm here, I'll run through some exercises for the hip as well. Okay, so as I said, when we are helping the knee, always we kind of just do knee and then hip, we combine when we do the workouts. So for the hip, a lot of times, this is a very, very good exercise for the muscles, the side of your hip, right in here, or glute muscles, what we call it. Okay, the hip abduction, the anatomical term. So you kind of just lift it up, you go flat, you really relax up in there, and then lift your leg up to the ceiling. Your leg up to the ceiling. Make sure when you're doing that, your hip is not rolled back, the hip is rolled forward so that you're using the right muscles and you're not using your muscles in the front of your thigh. Sideways, and then you kind of just do that. So you could also kind of just add some, excuse me. You could also kind of just use a resistive band and you can do the same as well. And now the other exercise for the hip, we call this as a bridging exercise for the muscles at the back of your hip, what we call it as hip extensors. Simple, and then do this. It's called a bridging exercise. Okay. So we could also do to kind of a challenge and then to kind of strengthen more, we call it a single leg bridging, basically bridging with one leg. So lift one leg up, hold that in position, and then lift your hip up to the ceiling, hold it for a few seconds, and then let go slowly. People with back pains or SI joint issues and those things, it's a good exercise, but at the same time, if it is hurting, then don't do it because you always need to modify those exercises. Okay, yeah. Then of course we could do some exercises for your hip rotators. We kind of just, use the elastic and do this way, or in a side line, we could do that as well. And another important exercise before even people doing this, we kind of just start off with something what we call it as a clamshell exercise, because depending on the age and how much they can do that exercise, so it's what we call as a clamshell exercise. It is simple, very effective one to get started off, and then we progress to this exercise. Okay, so I think I'll kind of just a few minutes. I know everybody is kind of just in a listening mode. How about everybody come up and then kind of just do some simple stretches for your hip and knee. Okay, doing this on a regular basis, of course, you can just maintain the stretchability and then, of course, not have too many problems up in there. Okay, have a healthy joint out there and you can function better. So is everybody ready there? I don't know how many audiences are there, but now I'm going to show that. Dr. Rafiq doesn't want to get up from there. That's fine. Okay, so let's kind of do the stretches for the front of your hip. This is for the hip flexors, and for the quadriceps. Kind of just grab your ankle. Okay, so when I'm doing this, a lot of times I see people actually kind of just, going down and then doing this. I don't want that happening. Instead, your hip is being pushed forward, okay, knee pulled back, okay, and then your shoulders back. So basically, you kind of just see this curl, like, okay. So this way, what happens is you feel a very good stretch up in the front and in your quadriceps. So stretching is always good. You hold for like a few seconds and feel a good tension up in the front. And if you feel you're not able to achieve that, too much tension, the best thing you can do is you can actually kind of use a foam roller or any kind of a rolling pin, or even you can use a a tennis ball to kind of just go push and then release the stiffness and then come back and then just try again, and you'll see the difference actually. So when you do that, so that's what we call it as like some tools at home that you can really do it yourself kind of a thing. So when you feel that lot of tension things, get your hands in, loosen it up, use a rolling pin, use a tennis ball, and go on the floor or against the wall, and then just release all the tension, and you come back and retest and see if that has helped. Okay, if that's not helping, come and see us. Okay, so that's one. And now coming for your hamstrings, there are different techniques of doing for the hamstrings. The simple one, we get started off in lying position, stretching out like this, holding for 2 seconds, and then let go. So that's your hamstring stretch. So people like to do that way. You could do depending on like where you are, like at your workplace, somewhere you can still do the stretch. So find either a staircase or a small step stool or any kind of stool. Get your leg up in there. Okay. Keep the other leg straight because you don't want that to be completely rotated out. So you want to make sure you're keeping it straight. Just like straight and toes pointing towards you, you already start feeling the tension at the back. Okay, hold the tension. Okay, and then, as I said, when I'm doing the stretches, always like I encourage my patients and everybody to actually kind of just get your hands, just that tactile sensation, and a nice, gentle releasing techniques. Release the tension in the muscle, just move things around. Okay, rub it around. You'll see the difference right away that you can stretch better. Okay, so if it starts cramping, okay, so try not to kind of just push too much up in there. Okay, so that's important because you don't know what's going on in there, like a white started cramping and things, back off, and then start gentle again, so in a different technique in lying position, that's what it is. Okay, yeah. Now, as you start feeling the tension up in here, to kind of just stretch more, then you can actually kind of just go forward, bend down, and feel the tension more at the back of your knee. Sorry, back of your thigh up there. So that's your hamstring stretches. And people also do like to kind of just go on the floor, close to the wall, and then they kind of just have one leg on the floor straight up, and the other leg, excuse me, and the other leg is walking up the wall, and that's a very good stretch as well. So those are the stretching techniques for you. Stretching techniques for the hamstrings. And most important is, I know, when we're talking about your knee problems, sometimes yes, problems in the inner side, you definitely need to do some stretches for your adductors or inner side of the thigh. Just getting closer, nice and tall, and then kind of just stretch it out. Do that. And now coming to the stretches, the most important again is the IT band, because I did stress a lot in the beginning about the IT band, the issues, which is a tight structure. It takes forever to kind of just get loosened up and creating a lot of problems around that area there. So how to stretch this IT band, the different techniques of doing it. People like to kind of just use a rolling pin to kind of loosen it up. They can do it in sitting or lying or whatever is convenient, or have somebody help you out to kind of just roll your IT band. And then stretching out your IT band, the different techniques you could do. Let me just see. Excuse me, I want to make sure everybody can see me. So, okay. So if I'm stretching my right IT band, my leg is slightly kind of just rolled in a bit, okay? And then my hip is pushed in that direction, the side that I'm actually stretching the IT band. So hip push that way. So what I do is take the help of my opposite hand, just push it out, and to kind of just give that extra push again, I cross my leg, the left leg in the front, and then I take the help of my left thigh to push my right thigh out that way. Okay, and I feel a really good stretch up in here. Okay, you see how nicely I try to kind of just lock it using my left thigh to push the right thigh out there, and adding on extra force here, pushing my hip out, and then I feel a good stretch up in here. Okay? So from my years of experience, sorry. So from years of experience, what I learned is for IT bands, stretching alone is not helpful. Okay, so you need to actually kind of just go use a rolling pin or use like a tennis ball, really kind of just roll it, or a foam roller on the floor. That's the best way to kind of just work on the IT band. So combination of things will be quite helpful there as well. Okay, and yeah, another simple stretch that we add on to the hip here is called as a hip rotation or the piriformis stretch, because a lot of times people having issues up in here traveling down always think it is uh, pain, what we call as a sciatic pain, because every pain is not a sciatic pain. There's something probably down the road I could just talk about what we call it as everything is not a sciatic pain, because I know the referrals that we get in our patients coming in, they commonly talk about the sciatic because everything is not sciatic pain. So I don't want to divert now. I'll just come back later. But another uh, good stretch that you can always do to help loosen things up here. Okay, so simple technique: figure four, cross your leg onto the opposite leg, and then bring the opposite knee towards your chest, grab it, and then you kind of just hug that knee. So you feel a very good stretch right in here. You will feel that right away. And now to add that extra stretch, I ask my patients to gentle roll out that way. Okay, basically bringing this knee, your left knee to the right shoulder, and vice versa. Hold that for a good 15, 10, 15 seconds, or even more. Okay, so for stretching, the longer you hold, better it is. So that's another important, very good stretch that you could kind of just do on a day-to-day basis. Okay, so this stretch is very simple depending where you are at home, like at your workplace, you have an opportunity to go. Stretching is always good. Okay, so now we worked on the stretches. So let me kind of course, we need to do, whenever with the knee problems, we always kind of just like to stretch your calf muscles as well, the muscles of the back of your leg, the calf muscles. So the way to stretch your calf muscles, once again, you could line a simple stretch, trying to kind of just use a belt, anything, and then pull your foot towards you. You feel a good stretch up in here. So this is where you start up, a simple stretch exercise. Then you can actually progress to finding a staircase or edge or somewhere, and then kind of just pushing the heel down and feel a good stretch up in here. So you could try that as well. And then there are a lot of, sorry, I know there are a lot of techniques people do against the wall. You could, there are different ways of kind of just stretching your calf muscles. You can look into it and then try doing the calf muscle stretches. Okay, so coming back to the knee exercises. So we did some simple exercises up in there, what we called active range of motion exercises without any stress on the joint. We started off that. So I'll quickly kind of just go over it for people who did not pay attention to it. So initially we did this knee flexion extension, what we call it as the sliding exercise. We did that. We also did some, what we call this, going this way, hamstring curls. And we also did pillow or a soccer ball between legs and then lifting. Okay. So this is where we start off, and followed by, as you progress, you could either use an elastic band or you can tie some weights around the ankle and then doing the same thing to strengthen up. So this is what we call it as resisted bands, and they come in different levels. So you can always start off with the least resistance and then just gradually progress to, as you get stronger, you can actually progress to the higher level, what you call the blue bands or the black bands are kind of just the tough ones to, that gives you a maximum resistance when it comes to elastic bands. That's very simple. Either you can just tie down to the chair, to the bed, or if you have nothing out there, just use your other leg. Okay, and then do that. Good knee extension, hold and let go. This is what it is. And you might ask me like how many times to do it. So usually in a clinical setup, depending on the condition, I always tell my patients, start off with 2 sets of 10, 3 sets of 10, or it's not that bad, then you can do 2 sets of 15 and progress to 3 sets of 15, 4 sets of 15. Even 2 to 3 times a day is good. But if you can, then at least twice, like morning and evening is quite helpful there. Okay. So with this bands, you can do a lot of exercises for your knee, the same exercises that I showed here, simple exercises. So you could add on resistance and then just do the same as well. Okay, this is for exercises. Okay, yeah. Now coming to, that's your quadriceps exercises or free simple exercises. Now coming on to your hamstrings. So as simple as what we call it as a hamstring curls. Let's see. Excuse me for a sec. So you can sit on the stool or on the chair, then tie somewhere, and then pull back and let go. Pull back, let go. Pull back, pull, and let go. So these are what we call it as hamstring curls. Once again, non-weight bearing exercises, but still kind of just adding on resistance to kind of just improve the strength in the muscles around the knee. That's good. So there's less impact on the joint. So these are the exercises. It doesn't really cause too much problem, and they're always kind of safe to do, and you can continue on. But unless and until, depending on what the problem is, when you can do this and when you cannot, so that's something that you have to discuss with your healthcare professionals. So it's always better. Okay. Oh, 7:56. Sorry. I know. I start talking and I never stop. That's a problem. Okay. I just want to show some good exercises on a day-to-day basis. I know a lot of times it's not just arthritis alone, but for a healthy knee, which actually kind of just, it's a group exercises that kind of just stabilizes, works all your muscles, your ligaments, and the structures around, at the same time. Some of my favorite exercises, what I call it. Okay. So let me kind of just show you those exercises really quick. And after that, probably I'll kind of just give it over for a question and answer section. Okay. Excuse me for a sec. Can you hear me? Great. Yeah. So these are my favorite exercises. As I said, these are good strength and stability exercises. Very simple. The most important when you're exercising, always keep in mind your knee is not locked. When we talk about lock, bone on bone, nothing is happening. Okay, so you have to just gently unlock your knee, or 10-15 degrees of knee flexion or unlocking the knee. Okay, then based on your ability, you can stand with support, without support. Okay, and then start challenging, moving the other leg. Okay. So what I do is I call this as like a clock position. So from 12 to back to 12. So what you do is standing on this leg, you actually kind of just stretch to 1 o'clock position, come back, go to 2 o'clock position, come back, 3, come back, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Okay. So if you kind of just noticed when I was actually doing that, when I'm stretching, I'm using my hip and knee, and there is a body movement that is happening. See that? So that way it works all the muscles together, works all the stabilizers, ligaments, everything to kind of just, hold your knee really good. So that's one of my favorite exercise. I like to kind of just keep doing that, So even when I'm working, basically when I start, we're up standing there for like, good 9 to 10 hours, So this basically sometimes, yes, we kind of just go out there and do some quick exercises, stretches, back in action again to help our patients. Of course, there are a lot of people like to do this squats as well. Either you could get started off with the wall squats or the squats. If your knee is good, healthy, and then progressing pretty good, then you can do some nice squats, So hips, squats, when people are doing, you always kind of just do not make sure your knees are not kind of falling in front of the toes. They're kind of just, so your hips back. Okay. So I think I will. So I'll wind up. I know it's 8 p.m. now, so we're past the time for Q&A. And I got a very long day, but still, I'm here to kind of just answer the questions.
Thank you very much, Ramesh. This was an excellent session, and we learned a lot. Especially, I learned a lot. Like, we started with anatomy and going through different knee problems and exercises. Very nice. Thank you very much. And we have a few questions, especially came from Facebook viewers. First question was actually your last segment for exercise for healthy knee. That was related to that. Do we need any regular exercises for knee, even if we don't have any problems? I think you showed us very nicely, but if you want to add on to anything?
Definitely, exercises are always good, okay? But this is what something you need to keep in mind, even though you don't have any problem, okay? Healthy knee, great, but you don't know there is some deficits over there that can bother you at a later date. So if you kind of just focus on a regular stretching program, some of the stretches that I showed in, and some of this 12 o'clock exercise, which is a combination of exercises. So that is actually going to kind of just keep the knee healthy and then stable. Yeah.
Excellent. Great advice. The prevention is better than medicine, basically. So excellent. So next question is related to braces. The question is like when you have knee problem, when you go to drugstore or any place to buy some braces for knee, there's so many options. We are so confused. What to choose and how to choose?
That's a very good question because there are a lot of those braces that are out in the market, okay? So when it comes to the braces, you need to always kind of just research or talk to somebody that has knowledge about braces, okay? Call your friend or family member or a healthcare professional that, so that well, or even sometimes people do actually drop into my clinic to just ask about that, hey, is the right one? So I quickly kind of just answer their questions like, so hey, and whatever, if I have something, I show them these are the best things. So because I'm not losing anything by kind of just sharing that knowledge. So the reason is there are so many braces out there, but depending on the problem, okay? Because do you need there's something when you call, or all you need is just a knee sleeve to kind of help your swelling, or what you call the tactile sensation. You feel something that is kind of hugging you, you feel great. All you need that, or you need a hinge knee. When we talk about a hinge knee that has side supports on the joint, okay, so those ones are basically to kind of just help non-weight bearing, so less weight on your joint, and also stabilizing the structures that are at fault and easing of the stress on your knee joint. So they could be used for multiple reasons, okay? That is something that you can pick. And then if you have a kneecap problem, there's a special knee braces that comes alone for a kneecap problem, okay? You might have seen some of them that has like a hole in the front, and then they have some kind of a supports in the side. But it's basically they're trying to kind of just, keep the kneecap in position, not tracking it, and those kind of things, okay? So they're good. In the initial phases, yes, the braces, splints and braces are good, but using them on a long run is not good because what happens is they're supporting and then making your structures passive. Okay, on a long run, then you'll be so dependent on them. Without them, you can't function. Okay, so using it for a brief period, and of course, talking to somebody, to kind of make sure if things are all okay, to kind of come out of it and start exercising. Even when you're using braces, exercise, put the brace on. And depending, as I said, like if you have massive swelling, I don't recommend you put a brace and then make things worse over there. So always talking to somebody who has some knowledge into it is always good, recommended. And sometimes when you have a complete tears, you might see and custom braces that are given by a specialist or a sports medicine or physiotherapist, the custom ones. That is basically because the structure is completely gone. Yes, you definitely need a support till you kind of just rehab, strengthen your knee or the structures, you use it, and then gradually you kind of just wean off from those, splints and braces. Hope I
Excellent.
answered the question.
Thank you. So basically, ask someone who knows about it
Yes,
to prevent any
of
damage to
course.
the knee.
Of course.
Excellent.
I've seen sometimes people, they just, sorry to lengthen this, but I've seen a lot of times they just go pick and then this knee, this brace is not fitting it properly, or they're walking, but it's slipping off, you know. They come to us like, hey, can you help me? This is not how, because it's not the right brace for you. That's the reason it's not fitting well, so many of those things. It's always good to kind of just, take the advice.
Exactly. These things are not cheap, and it's better to have the right thing
Yeah.
instead of wasting money on different things.
Exactly. So in my clinic setup, what I do is like when I have patients walking in, hey, I'm looking for something. Can you suggest? If I have off the shelf something, I recommend that. But what I do is I do tell them like, yes, I'm just only recommending something like as per your request. You can use it, and this is the best thing. But I'm not actually putting them as an assessment, but I'm just kind of dispensing them too. So yeah.
So, Ramesh, there are lots of questions, but I'll take two more because we are over time. If you
I'm
can,
okay. I'm okay. Yeah.
you're okay? Excellent.
Yeah.
So, two more questions we can take. This very important question regarding exercises to avoid in knee pain. What exercise can harm if you're having knee pain? What we shouldn't do?
No, no, it's a good question, but this is once again, there's so many exercises, there's so many techniques, and depending on the structure at fault, that's very important that you need to know. Uh, well, it could be a trauma, it could be a tear, could be a fracture, it could be a post-surgery knee. So to go like this, or it could be just acute inflamed knee. So depending on all these things, so that's why we are here it's very tough to say for which condition, which particular exercise. So we need to kind of just tailor the exercise based on the problem. Okay, but some of the simple exercises like what I showed on the bed exercises, a range of motion, and then simple active exercises, they're good because they're not going to harm you. But at the same time, anything advancing like a more strengthening and things, it's always better to kind of just talk to someone again, because you don't want to kind of just irritate more, and make things worse over there.
Excellent. Great advice. Again, because there are so many conditions for knee pain,
Yeah.
so many things can cause.
That is, yeah, that is the reason. That is the reason why I did not really directly jump on to kind of just showing the exercises. There are a million exercises you could Google, you can get it. But at the same time, having a bit of a knowledge about your knee and the common conditions, so that, yeah, it's incomparable, when you have that knowledge.
Excellent. So I'm going to take last question. So this is a very important question, and we even in our clinic we're being asked these questions. The question is: I have a bad knee. What exercise can I do to lose weight?
When you have a bad knee, the thing is you cannot do weight bearing exercises too much. So that you have to keep in mind because of your body weight, and that's kind of just a lot of load on your knee. It's already kind of just creating a problem. And if you try to kind of just do too much of weight bearing exercises, that's going to kind of damage your knee and then make things worse over there. Okay, so you have to do non-weight bearing exercises. When we talk about non-weight bearing exercises, like a free exercises on the bed, on the floor, mat exercises, things like that, that's where you get started. You need to build up the strength around the knee so that the knee is kind of good to kind of just hold the weight of your body. Okay, and for you, when you talk about losing weight and then knee problems, aquatic exercises are the best. In the pool, exercises or the best. So that is something that you need to try out, is like a pool exercises, walking in the water, sitting in there, and then doing some strength training exercises, you know. But of course, so going in the pool is good to lose your body weight as well, because what happens is if you end up doing too much of your, it could be a bike endurance exercises are good, but at the same time, uh, trying to kind of just put less load on your knee exercises that kind of puts less load. Like a free bike is good. You could probably go on for a while. People use ellipticals, cross trainers, those things, but depending on like how much your knee can take it as well, your body weight, and those things matters as well. Okay, and of course treadmills. Once again, yes, you're walking, that could stress your knee a bit more. So cardio is good, but at the same time, non-weight bearing cardio program on your knee is good. Best thing for me, my favorite always, I kind of just recommend my patients pool exercises. Just go in the pool, and then that's good for your endurance to lose weight, and then good on your joints as well and muscles.
Excellent. Very good. Thank you very much, Ramesh. I think we'll end the session
Welcome. Yeah,
now. Very good session. Thank you very much, Ramesh, for
very
taking
welcome. Yeah,
time out of your busy schedule and sharing with us your knowledge and expertise. It was a wonderful session. I was hoping that there was no COVID era. We could have done it in a hall, and we can do also exercises with you.
that's right.
So
Yeah,
excellent. So everybody, so next session, Ramesh is going to have it on 22nd of October. So it's after a month, and Ramesh will bring some different topic, and we'll look forward to that. Thank you very much, Ramesh, again. And everybody, you know where to find Ramesh. Genesis Physiotherapy. If you have any issues, any question, you can ask your doctor to refer to him, or he can be approached directly at Genesis Physiotherapy. Thank you very much, Ramesh, and everyone. Good night, and see you with another active living session on 8th of October with our another presenter. Thank you very much.